Your passcode is confirmed. When you hear the tone, you will be the 16th person to join the meeting.
Hello, I'm the Director of Client Services for Women Certified, and I wanted to welcome everyone to today's webinar, brought to you by Women Certified, the home of the Women's Choice Award. Before we begin, I wanted to take a moment and remind all of our hospital partners that Women Certified has multiple resources to help you with your strategic planning and your implementation of programs targeting women. We're here to support you with our complimentary art, marketing strategy sessions, and digital media consultations, basically geared towards identifying solutions that can further enhance your current efforts. Many of you are also familiar with our women-friendly 50-on-point assessment and training programs that we offer hospitals. Please know that our objective here at Women Certified is to ensure that you are experiencing maximum value out of your award program. Please also save the date for our next webinar scheduled for May 15th. Our guest host will be Linksit Solutions, a communications consulting company that has created web-based applications to simplify and improve communications in healthcare facilities. Linksit helps doctors and nurses improve patient care, operations, and the overall communication process. This webinar will target hospital team members such as chief medical, operations, or information officers, as well as department leaders within the hospital. We look forward to sharing more information with you shortly. And also, please know that if any of you have any questions regarding our new branding, please feel free to let me know. Now, at this time, I'd like to introduce Delia Passy, CEO and founder of the Women's Choice Award, and our host for today's webinar.
Hello. Happy 12 o'clock Eastern time to you, whether it's morning or afternoon, but it's great to be with you. Apologize, probably saying, hey, that doesn't sound like Delia. Well, Delia is suffering from a little laryngitis, but hey, I could speak today. Better than yesterday. I had to cancel 2 radio appointments, so I'm glad that at least you could hear me. So anyway, we're going to get started, and I'm going to talk to you. You know, if you were with us last year, we also did the same survey. We continue to do it every year. What we're finding is new trends. And I think you'll be, probably surprised like we were to see what's kind of moving in regard to some really interesting things that we're identifying are becoming more and more important to women when selecting a hospital. And really, it's not just selecting a hospital, but what's impacting their entire overall patient experience. So this is going to be really great. And I am so delighted that you're on the phone because, you're going to take this back to your team. You're going to take it back to your patient experience people. Please take it back to your nurses, your doctors, everyone, because at the end of the day, hearing this over and over and over again is important because that's when you start impacting people's behavior. It doesn't happen when you tell them once or twice. It tends to happen when they hear it over and over and over again that these are the things that are most important to the patient, and we have to start focusing on them. So glad to have you with me. All right. About me. You all know about me, most likely, but we do actually have full visitors. We have hospitals that are considering joining our partnership on today. So for those who don't know me, I was the former publisher of Working Mother, Working Woman magazine. I did start Women Certified to represent the collective opinion recommendations among women. It's the leading research company focusing on women consumer behavior. We work with about 30% of Fortune 500 companies doing surveys and research and training. And I'm the author of the book, Winning the Toughest Customer, speaker, trainer, et cetera. And, of course, we are the home to the Women's Choice Award, which all of you are proudly using. And, by the way, just as a quick side note, we're just so delighted to share with you that we have doubled the number of companies, major brands, carrying the award, all of our amazing hospitals. We couldn't be prouder of what we're doing together, partnering in a network of companies that are demonstrating their commitment to empower women to make smart choices. So thank you and feel good about your decision to be part of our network for sure. So this is real data. This is information that we did to help you have a deeper understanding of what is driving the patient experience for women and their family. Okay. I already told you these things where, these are findings coupled with trends and stuff. So, okay, let's move on from there. Where are we? Okay. All right. So one of the things that I will tell you we continue to hear is that women don't really feel like marketers get them. And we continue to hear this over and over and over again to the point where, it's over 90% of women will tell you that most marketers don't understand how to connect with them. What are the compelling messages? I'll give you a perfect example. I was driving by and I saw a billboard for a children's hospital, and it said powerful medicine. And I was thinking, wow, if they only understood women, what are women looking for when they're taking the child to a hospital? You immediately probably are thinking of all the things that are important to her. Powerful is probably not one of the words that would resonate with her. So what I'm getting at is that really do your homework, your due diligence, or call Susan and say, hey, Susan, we're ready to do a campaign. Could you do a quick, we call them survey pulse, to just see if we're on target with our messaging? Agencies all over the country use us, Omnicom, so forth, to do major campaigns. We test it. We take the risk out of doing campaigns that may not work. So we take the risk out of that and make sure before you go forward you know what will work with women. So please check with Susan. We're happy to help you there. So what's impacting her decision? Your reputation, your communications experience, and services streamlined to fit all of her healthcare needs, but we're going to go into all of these in detail. Okay, so who took the survey? Almost all women. We do have our couple token males. We love them, by the way, but we just looked at the survey results of our females. We had 768 respondents. They had to have a hospital experience within 24 months. Here's what I found interesting. The last time we did this survey, we found that it was about 89-90% of women said that they were the primary healthcare decision. It's up. It's now up to 93% of women are saying that they were the primary healthcare decision maker. Wow, it's even growing, the importance. And American Express Financial Services did a study with 30,000 families that carry a card, either the gold, any of their American Express cards. And what they found is actually it was 96% of women that carry American or families, and actually they didn't survey just women, they surveyed, the card holder, that they pointed to 96% of whether it was a male or female taking the survey said that the woman in their household was definitely the primary decision maker when it came to, health. So this is only growing. And so what we did find, though, is when we asked these women how they were mostly using their hospital, it was either their primary physician was associated with it, or they were going in for a mammogram or a bone density. So it seems like that's where most of the women are saying their connection to hospitals are. And that's an important thing to note because obviously that then becomes your center of communication for her to pull her into other opportunities, and the median age was 48. So some trends that we identified. We're seeing more and more moms wanting this celebrity experience, and I think, we don't know exactly the root of it, what was the tipping point here, but we're thinking it was when all these celebrities started, profiling their baby birthing experience. And so more and more moms, and then you have hospitals who are investing a lot of money in their birthing experience, and women are talking about it, and they're sharing it with their friends. And before long, you have these women choosing a facility not because of the clinical piece of it, but because of the, what we call celebrity experience. We've had hospitals who have called us that did not make our list of America's best in obstetrics and saying, hey, but, we have a NIT3 unit, we have this, we have that, but we noticed their recommendation scores were not high, and when we did a little deeper dive, we found that a lot of those obstetric hospitals that may have the best maybe clinical care didn't offer what women today are expecting in a birthing experience. And today, remember, it is a family experience. It's the time when families are walking through your hospital, excited to walk through the halls of that hospital for a wonderful experience because in 99% time, it is a great experience. So, that's a fabulous time to connect to the family. Women more than men continue. This has not changed. Women still continue to look for cleanliness, friendly, caring experience, better communication. We'll go into what that means, and consistency and continuity of care. Okay. More trends. Robes. We continue to see that women are challenged with respect and privacy. We'll go into a little bit more in that. But, they really, and that's why in our newsletter that probably came out about 6 months ago, we did a whole story on robes. And we had a lot of hospitals calling us to get more information on how they can find these organic robes that fully cover the women. The ones that still tie in the back for her, that keep that gap, are very uncomfortable. So make sure you have 2 robes available, one for the front, one for the back. Especially if you're going for a mammogram, there's some really delightful opportunity to buy some really great robes that women are raving about now. Some of them are actually saying that they're starting to sell them at the hospital gift shops because they like them so much. So, here's an opportunity to really, why don't you put your little logo on there, and so women could be reminded of the great experience they had with you every single time they put their robe on at home. So extra attention from nursing staff. They want to see you more often. So, the buzzword, and that is not enough for them. They really do want, it's like they're just hungry for information. And I don't know exactly what the root of it is, but I will tell you that we're seeing this immediate gratification trend only growing. And I think it's because we're in the age of information, where at a click we can get information. So that old that level, that mindset that you sit and you're patient until people come to you is no longer around. I mean, that's old. The new is they need ways to have immediate information on, when they want it. So maybe there's an opportunity here, and probably in our next webinar when we're talking about these new trends and digital applications, maybe they'll be able to share some stuff with you. Prompt attention to patients. We're finding that they, especially family members, talk about the lack of attentiveness. So we'll go into some more research there. So here was the survey. What would make the most difference for you once you're in a hospital doctor's office? And so we're finding is that, here's one. They look me in the eye and listen first to what I have to say. Remember that the average patient has about 23 seconds of talk time before they're interrupted. Now, a lot of research has come out this year to verify that for every 1 word a man speaks, a woman will speak 3. So that means, well, he tends to be more direct. She would be, more into communicating in a number of words to express what it is, and sometimes in a roundabout way. While we find women have this circular pattern in their communication where they'll be more indirect. So, for example, a man might say, I think I need antibiotics for this. A woman will say, well, I've been experiencing all these things, and I'm concerned about this. And all along, what she wanted to say was, I think I need antibiotics for this. But she'll do it in more a circular, or she'll circle around the core message to get the consensus and buy-in she's seeking before a decision is made. That's more how women speak. So that to them is very important, that they're given the attention and the time, and that's where gender communication comes in. And if you're not doing effective gender communication for your doctors and nurses, please put that on my 2013 bucket list, because that's one of the things you want to make sure that your people are doing more of that. And don't forget that in our newsletters, you have downloadable tools that give you these gender-specific tools to go and share with your team. And, of course, at Women Certified, we have the leading training in the country, on effective gender communication for positive results. So we can always help you there. Now, the other things that are important to them, as you can see here, is that when you walk in, the concept of reviewing documents, when the doctors, the best practice is to review the file before you walk into the patient's room. standing at the bed and reviewing the files is actually not as effective in demonstrating care and concern. So you might want to have a best practice that the doctor reviews it before walking in, because from the time that they walk in, you want them to pull up a chair, okay, eye contact, while the patient's lying on the bed, and you want them to give them that attention. And remember, don't ever allow, a doctor to sit on the bed, but they should be at eye contact at a seated level. And if you need to buy little stools that go behind the door so a doctor can grab that and sit down, what we have found is they do not, and you can tell the doctors this, they do not spend more time in the room when they're sitting versus standing. Okay, that's a fallacy. They will spend approximately the same amount of time, but yet the patient will perceive it as more effective. So making sure that, that they give them that eye contact and review beforehand. Other things that seem to be trending is, of course, courteous. If you tell them to show up at 7:30 for the procedure at the hospital, you need to tell them what the process is going to be. From 7:30 to 8 o'clock, this is what you're going to be doing. From 8 o'clock to 9 o'clock, this is what you're going to be doing. What you do not want to have happen is a patient walked in at 7:30 for a procedure that starts at 11 without the information of why they had to be there at 7:30, because now you've elevated the blood pressure of the patient. You've already set the tone of the entire experience. So at the end of the day, any good relationship starts with communication, effective communication. So always remember that you could do things and tools to make sure that people are prepping your inpatients, whether they're an outpatient or they have an overnight stay. They need for communication. And the other thing, too, is love cleanliness. Remember that, especially women, and she's very observant of that. So just seeing, staffing with putting on gloves or washing hands, very, very important to them. Now, of course, things like remembering their name and having their own thermometer, those are the type of things that, always make her feel better. And for the ladies on this call, it's like when the trend is bringing your own nail clippers to get your nails done. You do it because you're protecting your well-being, and that doesn't change, especially when you're in a hospital. Next question, as a patient while in the hospital for procedures that require at least a 24-hour stay, what would be most important to you? And, we found a trend, what grew from last year is meals. I want to have more choices to my meals. And, I think we're becoming, slightly more in tune with thinking about the hospitality part of the name in hospitals. We're starting to look for the hospitals that are going to make our stay a good one. And so those are just some of the little things you could look at doing where you provide choices and maybe even go the extra mile where you actually have what you'd call room service, where women could then, or families could then call in to get food. And sure, there's going to be potentially an extra fee for that, but it's worth it, especially if they walk away having this great experience. I was recently on Virgin America traveling to the West Coast, and I upgraded for another, $50 or $75. I upgraded to the seat where I was able to choose as many meals as I wanted in this 5-hour flight, and just with a little screen, I was able to order it. And so there was never a cart that actually went through the aisles, but the flight attendants were constantly bringing foods and stuff just like you would at a hotel. How fabulous. Think of how we can do that. They could do that in an airplane. I'm sure we could get creative in how we could do it in a hospital. And then the other thing, too, is they really do want to see you. Being front and center is important to them. And then, of course, what we told you we saw a big trend is the 2 gowns. It's not, you probably would be cost effective for you to invest in 1 gown that does the trick, but the reason why they're asking for 2 gowns is because they feel that their privacy is being invaded, okay? And then here's another one. The prompt checkout becomes a real, pet peeve. And here's why you do not want to hurt the checkout experience, because you could do everything right, but it's the last, 3 feet of the sale type of thing that can strongly impact your experience with your HCAP scores. So let's say we know that checkout's a problem because you have to wait for the doctor, you have to do all the approvals. You know better than me. This is your business. But having been a patient, being told I was leaving that morning or, versus I would be checked out by 2, and sitting on my bed with my clothes on since 9 o'clock in the morning was very uncomfortable for me. And so, and actually really kind of left a bad taste in my mouth. So, whatever. So what I'm saying is that why not say to them that, checkout typically will happen 75% of the time will happen between 11 and 1, or something to that effect, so they know that there's a window. Okay, it's kind of like, when you're expecting delivery. We'll be there between 1 and 3. So give them a little bit more information and try to streamline the process so that then what happens is you exceed their expectations. Remember, to make a customer happy today doesn't mean meeting their expectation. It means delighting them and wowing them in the process. So how do you wow a patient? By saying, you know what, we should have you out by noon or 1 the latest, and then their checkout happens at 11. And now that everyone is thrilled when you go, you know what, whenever you're ready now, we're ready to take you in. And now they're excited. Okay, so, and you could prep the family for that. Whatever it takes to make them happy, just go above and beyond. Okay, what would make a difference while sitting in the hospital waiting room? Another big issue, because this is impacting reputation not just for the patient but for the family. And one of the things that we see is very important to women is that that communication is front and center. Okay, so they look at communication, give updates as courtesy. And that's just, it's one of those things where, again, we expect. Now, I was visiting a hospital that actually had a board, and it kind of looked like a flight board, like at an airport where it gave you updates. I thought that was fabulous. It gave us updates to know where our family loved one was in the procedure process. I thought that was terrific. But it's always great for somebody to come and kind of look you in the eye and smile and say, they just got out, everything's fine. There's just something about the human contact that is wonderful. So courtesy and respect for those in the waiting room are important. The other thing, too, is, believe it or not, we saw a trend where hospitals were finding less and less reading material, less and less information. And we had one hospital that told us, well, we're taking all the clutter away. Well, guess what? When you're in a waiting room, you do want to be occupied. Not all of us, in that haste of bringing a loved one to a hospital, will think about bringing their book or their knitting or their favorite magazine. So have information for them. And whatever you do, please, I went to one hospital in doing one of our training, and I noticed, Sports Illustrated throughout the waiting room. Great, but for somebody like, me that, would rather be reading, Architectural Digest or reading People magazine or reading, the New Yorker, I'd like some diversity. The other thing is I always see that opportunity to educate people about your programs. So people will read brochures, especially if they're going to be there for hours. Why not have your hospital magazine there, or some great information or invitations that they could actually sign up for to be part of an event or a seminar that you're doing? Give them things to do while they're there. Then the other thing is that we found a trend. Here was an interesting one. Real cups. How interesting is that? Having real cups versus paper cups. I don't know what the logistics is of that. That could be a logistic nightmare, or it could be an easy solution. But what we're finding is that people are saying, how cool would that be? And having multiple beverage solutions, not just the stale coffee, but, having those machines where they could have different options. How nice is that? And then, of course, there's other things that we could do. Boy, am I talking too much, so I need to go quicker. When visiting an emergency room, here's one that I will tell you is one that we continue to see always ranked number 1. I think you'll find this interesting. Nurses addressing people in distress and pain. What is important there, please understand, is that people share experiences. This is a collective experience. If you are in a waiting room and you have that crying, screaming baby who has an ear infection, or you see an older person moaning and groaning, we share, okay? We are a nation of people who empathize. And so make sure that you address those people, demonstrate concern and warmth, or take them into a private area or put them in a room, because we do share in their pain, and it will absolutely impact our decision to recommend you. And then, we somebody is always there to address them, especially if there's a crisis level, comfortable, et cetera. And if you look at the trend here, it all goes back to attentiveness and communication. So find ways to make it very available to them. And then when choosing hospital, where would you or your family member, what will impact you? Now, this, interestingly enough, does not change. This seems to be very, very consistent. Everything is important to them. The one trend we did see is quiet rooms. I've been saying this for a year. It has only gotten more. So we're seeing this, that it went from a 2.5 to 3 last year to now a little over 3. So it continues to creep up. This one area continues to change, and that is quiet rooms. I guess the buzz must be out there that, hey, I'm not going to hospital anymore where I won't get well until I leave the hospital. They're looking for their hospital stay to be more relaxing, so that's important. And then the other things you see here continue to stay top of mind, but most importantly is when they're looking at a hospital, receptiveness is very important to them. Okay, we want to know that we're going to be dealt with, especially with pain, when we need it. Okay? And, of course, recommendations. Then, of course, we do this to your benefit. Of course, we always ask. This has never been more consistent. I've never seen anything like it. We've been asking this same question since 2007, and it always actually went up a little bit. It was last year it was at 89%. Now it went to about 91%, 91 point something. But this is always consistent. They will absolutely trust your brand more if you market the Women's Choice Award, so please use it to your advantage. It's a strong competitive advantage for sure. So here's some new things. We did a pulse survey to supplement our national survey, and this we thought was really cool. We did it with 200 women, and we found that women are saying this is something they'd be interested in, an online personal wellness plan. Okay, things like this, to risk your factors, determine your wellness goal. These are we thought we would share this as a best practice because we thought it was a cool finding that we were able to uncover as a more recent trend. So you might want to look at this in ways to, how else can we supplement what we're doing with women, and how do we keep them engaged for us? Because remember, you want to build a customer for life, and most people say that they build customers for life from the time they come to have a baby. That's not the case because there's this big gap. Well, yes, it does work, but it's a gap from their 20s to their 30s to their 40s. So when they start really focusing on their wellness plan, probably in their 30s, is when you want to keep them as a customer for life. So think of an online process in which they could have that, because as you could see here, that you would say almost all women would be interested in something like this. Okay, let's put this into action, and then I'll wrap it up really fast. Okay, make sure that you always listen to the patient, lots of eye contact, prompt checkout, gowns that cover her. All right, make sure that they always have the option to have a loved one stay overnight. That's very important. Patients need communication in the waiting room. For sure, give them updates, create a digital update board. I think you'll learn more about that in the next webinar in May. In the emergency room, attention to the people who need it, but also communication to those who are waiting. Prompt help, very important. Fully leverage your Women's Choice Award, very critical to keep her, engaged. By the way, hospitals are telling us it's the only award that they've ever had that truly has started conversations among women. And I'll tell you, I don't think men talk about awards at all. So I think it's, women are really about this level of communication, and they love it. So give them a reason to talk about you. And now more insights. Empower your staff. If you haven't done gender communications, go back to our newsletters, download all those tools. You can go back a whole year, and if you need more tools, ask Susan. If you'd like to also schedule training with us, please let us know. We could do it in multiple ways, from online through live, but please make sure you do that. And if you have internal people who could do it, please do it, because we're finding that is the most critical issue we're having is communication and understanding what drives a better experience for women versus men, also important. And of course, talking to couples and stuff like that. Software solutions to streamline her care, we're finding she wants more of this. She wants to know that digitally you are connected, and you'll learn more about that next webinar, but please look at that as an opportunity. Personal wellness programs, like we said, what a great way to talk to her every single month, okay? And she'll be the one who will be proactive, not just reactive. And let your staff get involved, okay? National Women's Health Week next month, National Own Health Month, especially for, now National Women's Health Week, every one of our awarded hospitals should be able to fully leverage their award for this time of year. May, June, very big talking to women, especially moms. And then National Bone Health Month, for those who have our America's Best in Orthopedics, kudos to you, fabulous way to use this. But this is a big time of year for this. Another reason is we're finding that women are saying to us that they are looking at orthopedic hospitals, doctors, emergency rooms, because more and more information is given to moms when their kids go to camp or they're in sports activities. Know your doctors. Know the hospital. So if a sprain, a broken bone, God forbid, any of those things happen during these active time of year, you know where to go. How great that you can go out to them and go, we are the best solution for these sports industries or problems. So make sure she knows about that. And then, of course, create in-room communications. We covered that last webinar. We talked about in-room communications. If you did not participate in that webinar, please go back to our archives and look at it, because you'll get great information there, and of course we could always schedule time to talk to you about it. Remember that, well, I don't have time for questions, but remember that we are here for you. We do not charge. If you want us to, sit down and talk to you about your processes or your communications, we're here to help you. We are truly a partner, and we need you to reach out and tell us how we can help you more. But there's more stuff that's coming. Susan had created these certificates that are now going to be going into doctors' offices. She'll share with you more about that in upcoming conversations, but you should be receiving those. All of the things we're doing to improve the patient experience is to help you become a winner to her and her family. We never wanted to choose anybody else but you, and we're here to help make that happen. What I will do is, since we're already 5 minutes past, if you have any questions, please email Susan, slong@womencertified.com. I will answer them personally for you, and feel free to call us. Okay, you have our number, 954-922-0846. We're here to help you. Okay, so make it a great day. I hope that you found this helpful. I'd love your opinion on this particular webinar. And since we do this research every year, if you'd like me to ask different questions or more questions, please let me know. I'd love that information, because we're here to help you. Thank you. Have a wonderful day. And again, we are so appreciative of your partnership. Bye-bye now. Have a wonderful day.